Hi, everybody. Last session of the day. I'm so glad to see so many people. I'm really pleased to be here. I'm Wendy Weidner. I'm Head of Research and Publications at Alzheimer's Disease International. And I'm really excited about this panel talking about why national plans, national dementia plans are so important and how can we get it right. How do they provide a framework for good care for people living with dementia? And I just want to introduce we're going to have a panel discussion rather than a bunch of presentations. So we're going to do a little bit of a discussion and then we'll open the floor to questions. But I wanted to introduce my panel. We have at the far end the lovely Lorène Gilly from France Alzheimer, who's going to talk to us about the National Dementia Plan in France. And I'm Jane. I'm going to hope that I say your name correctly. Mahakian with Alzheimer's Care Armenia, who started a new plan. I'm going to talk about how we get plans started up and what's important to include. And the almighty Jim Pearson from Alzheimer's Scotland, who's going to join us and talk about how to keep momentum going on plans. So this is a hybrid session, so there are people listening out in space, I guess, and so they'll be able to send questions as well, so we'll be monitoring those, and as I said, there'll be questions later on. I just want to thank Alzheimer Europe for doing this panel, for having us here, and FPA, who have sponsored this symposium. So I'm going to start with just a few slides just to put things into context. Okay, so I know a lot of us know about the WHO in 2017 at the World Health Assembly. The members unanimously voted to have the Global Action Plan on Dementia. And they committed at that point to have at least 75% of those member states to have a dementia plan by the end of 2025. And these were the areas that were included. And the idea was that these are the key areas that need to be in national dementia plans in order for them to really provide that good pathway of care for entryway into a timely diagnosis, into that care pathway, and supporting both informal carers and professional carers, et cetera, and promoting research into treatment and into cure and care. So why are these so important? Like I said, they provide that pathway and that framework. And in our last From Plan to Impact report, on a yearly basis, ADI has done a report looking at the number of national plans that are actually being developed on a year-in, year-out basis. And what we're finding is that not every plan has every part of those 7 action areas. And that's actually okay, because what we want to do is get that low-hanging fruit. One of the things we talked about when we started developing this idea for this symposium was that we didn't want to make perfect the enemy of good. We wanted to have, it's better to have something in place than nothing at all, because all of these things are important for a national plan, but every country is different, every care pathway is going to be different, every medical system is going to be different, so access to treatment and care is going to be different, and so it has to be contextualized for the country that you're living in, and they can grow and change over time, which we're going to hear about later. So just to give you an update on how many we currently have, there are only 39 plans globally. This is a picture from our last From Plan to Impact. The red show countries that have national plans, the pink are countries that don't have a national plan, and the gray are areas where there are plans in development. So there's still a lot of work to be done. And one of the things that we talked about in our last From Plan to Impact report was that we're encouraging and calling on member states to call on WHO to extend the Global Action Plan on Dementia till at least 2029, so that it's giving countries more time to develop plans, and that we want to really accelerate it. And to put that in place, the ADI team has put in place the What's Your Plan campaign, which allows us to go directly to governments and encourage them and support them to get a plan in place. So we really need to strengthen health systems because there's a lot happening right now in the field. There are new disease-modifying drugs in the pipeline. We want to get people access to those. Equally, we want to make sure that we're providing people with a timely diagnosis and appropriate care all the way along and supporting carers. So I'm going to stop talking, and I'm going to leave this slide up, and I'm going to go over here to the team and start asking questions. And I'm switching microphones. So I thought it would be really good. We wanted to talk about the journey of developing a national plan. So we thought it would be really good to start at the beginning and to start with Jane, who's they've just begun a national plan in Armenia. And we wanted to hear from her the journey that they have been on. And so, Jane, I'm going to ask you the first question. And I was really hoping you could talk to us about that process. How was it starting the plan? What are the key things that you decided to focus on?
Well, thank you very much, Wendy. I've never been so happy to say that we're in the red. In reflecting about really, what are those key factors in what makes a successful first step of developing a plan, is really perseverance. I kind of was like a stick of gum that didn't go away. You have to keep at it. You have to keep pursuing. It really only takes one person to make a change and to create a plan, to start the plan, one person. So it really all began probably 2.5 years ago. I probably copied, downloaded, and redlined about 12 national plans that I found on the Alzheimer's Disease International website. And that was instrumental. I looked and studied each of them, looked at all of the different pieces of what was each country doing. And then I realized there's not one plan. It's a plan that has to be tailored to your specific country. So it's not like a one plan fits all, right? So in doing that, I then had to reflect on these plans and think, what's the next step? The next step is really to spark the interest of the government. Now, I go back and forth to Armenia, probably dating myself here, but since 1982. I had to spark the interest of the government because they did not see that there was dementia in their country. They weren't aware. They didn't see it. Their priority was not on older adults or adults with cognitive issues. That was not their priority. So in 2018, I partnered up with a national leading memory care community in the United States. And we created and organized the Alzheimer's Disease Conference, a first conference in the country. And it was well attended. We had over 400 healthcare professionals. And that sparked some of the interest of the government. They were very interested in that. They thought it was interesting. Then I thought, the next thing I need to do is to join, is to form an association. And I formed the Alzheimer's Care Association, representing Alzheimer's in Armenia, and joined the Alzheimer's Disease International, as well as Alzheimer's Europe, which we're very grateful for. So then, as time went on, I realized, well, the conference was very good, but then you need something else to spark the interest of the government. So I created a couple of healthy aging memory clubs in the country. And these were all really about brain health for elders, and the government thought that was very interesting. It really wasn't until I found a champion in the government who was able to drive the development of a draft that I had prepared by myself, as well as to set the strategic direction and implementation, is what was the key. But what really gave the eyes and ears of the government was our early detection memory screening and training project in Armenia, funded by Davos Alzheimer's Collaborative. This project helped open the eyes and ears of the government. And my champion became, as she says, Dr. Jane, the partner in crime. We worked even on the weekends together. And she was available. She would text me from Armenia. She was very responsive. So then we decided together that we would initiate some focus groups with healthcare professionals, really to understand the gaps, the barriers, and the obstacles in treatment, diagnosis, and care. These focus groups were invaluable. The focus groups were on Zoom, and they were also in person in Armenia. We needed to understand what were the myths and stigmas. I had some idea, but they were very helpful in helping that. Also, a multi-stakeholder approach was given and essential to form these focus groups that also included people with dementia. And they really said to me, Jane, how are we going to find the family and the person with dementia? And I said, you need to open your eyes and see. It's here in the country. Alzheimer's is in Armenia. The next step that we did is we conducted a situational analysis of NGOs, healthcare professionals, and other healthcare organizations. Once we organized together a mobilizing group that would take this draft of a plan, and each of us took ownership of the certain sections of the plan. So the priorities and the specific objectives were really created in a collaborative way. What was very important was the buy-in of each person. So I hope I'm on time, right?
Yeah.
Oh, good. Okay. I don't want to go on too much.
I'm too interested. So, yeah, I know that's.
So I want to make sure there's plenty of time. So the plan had to be flexible, and it had to be like not a one-size-fits-all. Together, the work group, and together with the input of that person and their family that has dementia, was really instrumental in us understanding their concerns, their care, the priorities for them and their family, because we could not prepare a national dementia plan without their expertise.
Yeah, I love the way you put that, and I'm going to steal your idea of being idea of perseverance being a stick of gum, because I think it's a really great description. But also how you've described almost like a ring, how the whole thing grew over time from that idea to bringing in more and more people. And I'm particularly interested in this idea about getting the interest of government, because I think it brings us over to what we talked about earlier, Jim, about this idea of how important it is to have that connection with government, to have things be sustainable, and to have that champion, to have that plan in place. Because you've had a national plan in Scotland since 2010, is that? 2010. And I know it's been through a lot of changes, so I wonder if you could talk about how do you keep the momentum going that long?
Okay. It's probably worth just maybe going back a little bit as well to the beginning of that strategy, and I should maybe start by making a disclosure. I'm from Scotland. I speak Scottish. I don't do English very well. Almost everyone in this conference speaks better English than I do, so Wendy, you might need to translate occasionally. You still better English than me, so I've got a colleague up there who's been working in Europe for several years now. He still speaks Dundonian. So I think just to reflect back a little bit, as I mentioned, Scotland is of course part of the UK. And prior to the creation of the Scottish Parliament in the early 2000s, we, like the Alzheimer's Society, were trying to influence a much bigger beast, which is Westminster. So there's no doubt, I think, one of the key elements in the progress that we've made in Scotland was the devolution and the creation of a Scottish Parliament, a Parliament which was much more, I think, accessible, certainly for us as an organisation, it had devolved authority for certain areas of policy, including health and social care. And that, undoubtedly, I think Scotland is probably just the right size to be able to get things done quite well. It's a small country with a population of about 6.5 million people. And so that, I think that was helpful. There was also, early in the first decade of the Scottish Parliament, there was a change in government for the first time in a long time. And that afforded an opportunity, partly because the First Minister had personal experience of dementia with a parent. Partly, I think, because they wanted to do things differently from previous governments, and partly because there had been some significant reports which were telling us that we weren't getting it right for people with dementia, reports about inspections in care homes and the experience of people with dementia in hospitals. So they got a lot of profile. So a lot of things came together. Scottish Government made dementia a national health priority. And that was a catalyst for a lot of change. If you create a national health priority, you have to do something about it. So one of the first things that then happened was work to improve the levels of diagnosis. If I remember right, at that time, only 1 in 3 people who we thought had dementia were getting a diagnosis. And there's no other condition on earth that you would accept that for. Right? So there was a heat target created. It's a health, efficiency and access to treatment target, which is about improving it's a performance target for health boards to improve diagnosis. So all of those things kind of came together. We were developing manifestos for elections, and one of our key asks was a national dementia strategy. And that came about in 2000. We'd done some work with the Scottish Human Rights Commission prior to that, and the Scottish Parliamentary Cross-Party Group, around creating a human rights framework. We call it the Charter of Rights for people with dementia. It was about creating a human rights framework and a new charter based on human rights principles for people with dementia, their families and carers in Scotland. And all of those things came together to create the conditions for that first strategy. So without going into great detail, the strategies in Scotland have been 3-year plans, and we like that. It's 3-year, very focused, specific sets of actions. That very first one had 2 key action areas. 1, improving the experience of people in acute hospital settings, and 2, improving post-diagnostic support. I should say one of the key elements of all of the national dementia strategies in Scotland has been the involvement and participation of people with dementia and carers. So we worked with the Scottish Government in partnership to create and run a series of dialogue events across the country. We as an organisation had been hosting since early 2000s. Many of you might have met some of the members here today, the Scottish Dementia Working Group. I think I'm right in saying one of the first groups of its kind, a member-led group of people who have a diagnosis of dementia, who campaign for change. And they've been working with and hosted within Alzheimer Scotland for over 20 years, and I've had the pleasure of working with them all through that period. In 2012, we created another group called the National Dementia Carers Action Network. But yeah, the voice of people with dementia have been embedded in those strategies right from the word go. 3-year strategies never quite worked out like that. Sometimes things would get in the way, elections, so it would sometimes run for 4 years. The big gap was in the pandemic. So I think Scotland can be rightly proud to say that it has had some of the most progressive dementia policy anywhere in the world. However, we haven't necessarily had some of the most progressive delivery of every one of those commitments. So there's been a lot of progress made in Scotland, a lot of good work done in areas of post-diagnostic support, education frameworks for staff, for anyone working with people with dementia. Promoting Excellence framework, it's called. It's a knowledge and skills framework, sets out the expected behaviours, knowledge and skills required of anybody working with anyone with dementia. There's a lot of work being done in hospital settings, in care home settings, a lot of work being done around things like reduction in antipsychotic medication. I won't go through everything, So that first strategy only had 2 commitments, so 5 priority actions, 2 key areas. The second one had 17 key actions, and the third one was over 20. And we've now just published a new 4th dementia strategy. The one thing I would say that's difficult about sustaining progress is governments have got no institutional knowledge. Politicians move on, civil servants move on, and we've been lucky in Scotland in that throughout most of that time there have been some key people, key champions within government. I'd say recently that's changed. There's a whole new policy team. They're still very engaged and still working with us, but they don't have the same history or knowledge of what went before. And so the consistency, I think, has to come from organisations like us and from the involvement of people with dementia and carers throughout that. And that's happened. And the Scottish Government have created their own lived experience panel. They are part of the development of the new strategy, part of the governance of it, which is excellent. However, I would also say, and I think it's probably true of the Scottish Dementia Working Group, I know I work with them really closely, that there are some voices that are not heard within there. That, you know, the 87-year-old person who's living in a care home, who's not perhaps able to join a group or participate in a group like the Scottish Dementia Working Group or the European Working Group. And I think there is still work to be done to make sure that those, in fact, the session we've just heard there too, from people from other communities, their voices are not necessarily all included within that. So we still have work to do there. So I think you do need, you need political buy-in. I would say when I first joined Alzheimer Scotland, we were one of the few organisations who were banging the drum for dementia. That's no longer true. Yeah, I think that we've got some really key stakeholders in both, you know, and within social work professions, within allied health professions, within our NHS, within clinical, within the research community, significant attention on dementia. There's a lot of other community grassroots-led movements, other organisations who have become involved in and working and supporting people with dementia. It's a much more complex, dynamic arena than it was in 2010. And in 2000, when I joined Alzheimer Scotland, it's certainly much more complex. And that we should celebrate. We've always campaigned as an organisation to say dementia is everyone's business. And that's where we are, right? But it also makes it a little bit more complicated because you have different interests. And sometimes when it comes to funding, we're all in the same pool, looking for the same opportunities. It can sometimes create a competitive environment for funding opportunities that in itself is not conducive to collaboration. So there is some challenges there about how do you fund all of that work? How do you create an environment, particularly for third sector organisations like us and some of the other groups, that creates an equitable, creates opportunity for collaboration, as opposed to creating an environment that in itself fosters a little bit of competition around funding. Does that make sense? Yeah, so I'm happy to stop here if you want to come. Yeah, so.
Thanks for that. I find it really interesting what you both have said about that sort of integral role of people living with dementia in planning and finding out what the priorities are, that you've both mentioned that, but that it then extends to other groups and getting interest, not only within government, but equally with other groups doing very similar work, other NGOs, et cetera, and keeping that priority within the government. And you hit on something that I think is quite interesting, is funding. That, you know, plans aren't, you need funding with a plan. They must, in order to implement, governments need to actually provide the funding around that and keep dementia as a priority. And I think, you know, and I didn't ask you about that, Jane. I mean, has your plan been committed to in terms of funding as well in Armenia?
No, we're not there yet.
Not there yet. It's okay. So that's something we got to push on.
Mm-hmm.
But I'm aware of time, so I'm just going to move now to Lorène also, because interested to hear your focus really, because France was really a leader for many years, one of the first dementia plans, wasn't it? And you know, there's been a shift in the country, and I think this is something about how, when a plan changes, you know, we've got a new plan, we've got a plan that's keeping the momentum, but when a plan changes and integrates into another condition, how do we keep dementia as a priority? So I think maybe you wanted to give a little context first about, yes, about dementia as a priority in France. So.
Yes, thank you very much, Wendy. Yes, in France, the public policies started to structure around the issue in 2001. And so we really started to see that an effort was brought by the government to take actions, concrete actions, to address this specific issue and to bring support to people living with dementia and their caregivers. Before 2001, the public response was really scattered, and it didn't allow to have a structured care and support for people living with dementia and their caregivers, and to have a concrete impact locally on the field. So we had two first plans between 2001 and 2007. And then in 2007, our Prime Minister declared dementia as a public national cause. And he declared, and I wanted to share it with you because it's really important, that this issue is a human issue, a collective issue, and an issue of solidarity. Which implies that the mobilization of us all, and we talked about this before, but it's also the opportunity to break down some numerous barriers, such as fear, ignorance, and misconception. And I believe this was the start of really the structuration of the global response that was coming just after, because in 2008, Nicolas Sarkozy launched, our president at that moment, launched the Alzheimer plan, 2008-2012, and it was about 44 measures for a dedicated budget of 1.6 billion euros. And it was really targeted around three main objectives: research, health, and solidarity. And the implementation of this plan was led with transparency and with a dedicated team which were working with all the stakeholders to make sure they will follow the implementation of the plan at every stages. And it really made the difference, and looking back at this time, we can say that it was a big difference, because in 2012, when the plan comes to an end, there is an evaluation of the plan afterwards, but not during the implementation, and maybe we will talk about this after. In 2014, we have a change of government, and the new government decides to build a neurodegenerative disease plan 2014-2019. And so this plan targeted three main conditions: Alzheimer's disease, Parkinson's disease, and MS disease. And it was 96 measures for only the third of the budget of the Alzheimer plan. So we see that there is something wrong here. And, well, this is how it went in France for the beginning.
So, I mean, it's... And you were talking about political will and change of government. It can change everything, really, you know. And like you said, politicians have a short memory, or they've got a short amount of time that they want to get their you know, make their name in politics. And so what do you do? Like, what are you doing now in France Alzheimer to sort of make a noise and to keep dementia as a priority? Because that political will changed.
Yes, well, we are trying to do a lot, so I made a list. But yeah, it's true that after 2019, we all agreed that this neurodegenerative disease plan did not have the same effect on the field than the plan just before. So we tried to advocate as much as possible to ask for an evaluation of this, taking into account our mistakes, because there was mistakes and there was too many measures and not enough budget dedicated to the implementation. And with the other stakeholders of the neurodegenerative disease plan, we decided to get together, and we created an informal collective to make some noise and to address this issue as much as possible towards politicians and public decision makers. And we also called out for public support, particularly during different electoral deadlines and campaigns. We also raised awareness for one of the first time at the European level during the European elections in 2019, and thanks to the help and support of Alzheimer Europe. We also put pressure on decision makers at different strategic occasions, and recently during the World Health Assembly in Geneva with the support of Alzheimer's Disease International. And we acknowledge that we had a lot of support from these two networks, and it's really important to get this support. And we met with as many MPs, French MPs, as we could to try to use legislative tools to address the issue with the government. And we created a specific tool also to, it's a review called Let's Act Together, and I will have the opportunity to present it tomorrow in one of the parallel sessions, to bring regular information about specific subjects around the daily life of people living with dementia and their caregivers to MPs and elected representatives of France. And we asked for the creation of a dedicated working group at the French National Assembly. And it took 2 years, but it's a reality now, and it was created at the end of 2022. And we have met with all the French health ministries, and believe me, there have been a lot since 2019. So we are trying to really stay focused on this objective and to raise awareness as much as possible and to give a voice to people with dementia and their caregivers, for them to express what are their needs and yes, what they need on a daily basis.
It's such a key role of an Alzheimer association, a civil society, to play that liaison role back and forth between people who are living with a diagnosis and government. But also there's people that provide treatment and care. And so you're sort of bouncing all over the place, trying to sort of connect all of those people. And I just wonder from each of you, or any of you really, just putting the question out there, as an Alzheimer association in your country, how do you see your role at really helping promote that implementation? Because we all know how important it is to have the piece of paper, but it's about the implementation of it. And maybe it's a little bit early now, Jane, for you, but I'm sure these thoughts are in your head about how you take from your the pilot study that you're doing to really sort of expand that even more, and to have some implementation, just to see your thoughts on how important implementation is, really.
Oh, absolutely. The implementation part is probably sometimes maybe some of the weakest area of a plan, right? So I had to translate the plan and the implementation, of course, implementation plan into English. It was prepared in Armenian, and I do not read Armenian. And I'm looking through this saying, implementation plan. And it was actually done very, very well. It takes a team. And what I liked about the implementation plan, which was discussed with our focus group, was that it really gave a powerful, it should give a powerful voice to every NGO and every organization, and also expanding it beyond the Ministry of Health to other ministries within the government. And that implementation plan needs to be clearly spelled out for the, and it is for the next 5 years. But I think that it's nice to see beyond the Association of Alzheimer's Care Armenia, implementation and ownership from the government on different initiatives that they are currently working on and launching in Armenia. In implementation of healthy aging, brain health initiatives, which is very important. So it's something that I think needs to be strengthened on our plan, as well as forward thinking beyond 5 years, as well as more policy formation, especially around brain health, and also educating. Maybe I'm going beyond the question, Wendy, but I think educating children on brain health is very important, and that's not something that was part of our plan, but it is something that I'm thinking about, because it would be a very instrumental in moving that small country and shaping what's been intergenerational, these ideas and myths and stigmas for many, many years about what does it mean to be an older person in Armenia. And several years ago, when you look around, there were no older people on the streets. So going to because they were in the home, but going and educating the children in the schools is really where we want to start. Because there we can change and make those shifts. That's where I'm thinking I'm going with another project in the new year. I'm already thinking, it was Dr. Sona's here from Armenia. But that's what I think is really, really pivotal to look at that.
Start them young.
Start them young, and then, you take the fear factor out of it, and they're understanding that a person that has a dementia leads very meaningful and purposeful life. It's all about changing the idea of what it means to have a cognitive impairment.
Scotland has some materials you can steal.
I would love to borrow.
Might need to translate that into
I can
English as
steal.
well.
I will. May I have your card?
Yes, about implementation, yes, it's key, and as I was saying before, it was really the difference between the Alzheimer plan and the neurodegenerative disease plan. We didn't have the same team to follow the implementation at every stages, and building a plan to address the issue around dementia is not just about putting our official signatures under a piece of paper. Millions of people in France, people living with dementia and caregivers, are waiting for changes and for concrete changes. So we have to remind this to the government at every stage. And right now we are working in France to build a new neurodegenerative disease strategy. So we should be great, and I hope that we will be ready in 2024, because we are working hard, and we are working for the first time in many years with someone who is dedicated to this subject at the French Ministry of Health. And sometimes it takes a person, and I totally agree, because it makes the difference. And it's amazing how it makes the difference.
Yeah,
Yeah.
don't quit.
Just very quickly, so yeah, I think I would absolutely agree. I think that governments don't deliver strategy, they develop strategy, but they're not able to. And I think where we've seen areas where there's been success, and in fact where the gaps exist, is because of that tension between the government aspirations. And in Scotland we have a National Health Service, we have 32 locally elected local government, we now have integrated health and social care, so we have about, I can't remember exactly how many, but it's about 90 health and social care partnerships. So that's the rocks in which implementation often falls. And I think what we've found over the years is that government needs to be held to account for the commitments that it's made. But we need to work with those partners, those local partners as well. And I think that's where we've found more recently that's where we can get success. So as an organisation, Alzheimer Scotland don't just seek to influence the Scottish Government, but to seek to influence individual health boards, individual health and social care partnerships, individual local authorities, get in line with them. There is a will, there is absolutely a great range of stakeholders in Scotland within the third sector and within, does that make sense, the third sector, the non-profit sector, yeah. NGOs, and also, but also with public service, public bodies. So there is a will there, but it's bringing that together and getting that priority of dementia and recognise that we can help them find solutions to some of the challenges they face. Because we're in a cost of living crisis, we're in a public spending crisis within the UK and within Scotland, I'm sure elsewhere, where local government and health boards will tell you they don't have enough resource to do all the things that they're being demanded in doing, but we are able to demonstrate the additional costs that you can save if you support people with dementia well, that actually not only can you change that human cost and that human crisis, but you can make it a more effective for the public purse as well. And I think that's where we're seeing that we can make a difference, is working locally as well as nationally.
I thought we'd open the floor to questions if anybody has any. I'll let, there we go, the mic in the back, please.
Hello to everybody. Everybody was great. Just 2 notes. When saying that we have to inform and go to schools to learn out about dementia, I just want to say something. You know, people with dementia is not only old ones, all right? So some of them, they have children, okay? So it's good to know what is wrong with the mother or with the father. They're not in the position to realize what is dementia for the family. Another statement, I want to say something about ADI. The grey ones or the red ones, all right? Has the ADI visited the countries to see if they actually implement what they are saying to ADI, what they send to ADI? This is like a question. Thank you.
First, thank you for that. And 2 parts to that, because I'm curious, because I think that is a gap, what you've mentioned first, the sort of younger onset and families that are coping with this. And do any of you have any, have that as part of your plans, or are you providing any support for that? And then we'll go on to part 2.
It's absolutely part of the Scottish plan, and it's absolutely a part of the core work that Alzheimer Scotland does. And just very briefly, we've recently established a partnership with the Childhood Dementia Initiative in Australia to do more to support families of children who are living with dementia. And I won't go into that in great detail, but it's estimated there's about 450 children living with childhood dementias just in Scotland alone, that's equivalent to motor neuron disease, which quite rightly gets the attention that it deserves. So not only, so dementia is a lifelong, potentially lifelong illness that can happen to children as well as people who are younger. So absolutely, that's a priority.
Yeah, I thank you very much. Your points were well taken. Brain health, right? In the schools, in the curriculum, really focusing on risk factors. And of course, that goes along with early detection. We have noticed in the last 2 years that younger people are calling our helpline. We have a national helpline that we created in 2019. And so we are very aware, and that is part of Armenia's National Dementia Plan, is to address those issues, because the issues are different. The husband that calls us and his wife is 50 years old, the issues are going to be, and the concerns are very different, and that needs to be addressed.
Yes, we adapted a lot of our activities to address this specific issue and the specific needs of people living with young onset dementia and their caregivers. And often they are still working, so there are also these objectives to have in mind. And we tried to address this issue in the last strategy, but, well, it didn't went as well as we hoped, and we are asking that there are some dedicated measures to address this issue in the next strategy as well.
And about so whether ADI visits the country, so we really rely on our members to help us, keep track of what's happening in each country. But that's part of our What's Your Plan campaign, is visiting countries where we're asked by our member to sort of help support that. So that's what we're trying to do with that. And listen, I've got a couple more questions, and then we have a video message from the MEP and Alzheimer Europe board member, Sirpa, and I'll try to say her name, Pietkäinen, thank you, who's going to give a message to you guys. But let's do these last two questions. Martin, please.
Hi, I'm Martin Knoll from the UK, and I guess one of the questions around how far the plans have been implemented is a bit like saying how long is a piece of string, because there's always more work you can do and there's never quite enough being done. But I'm wondering if it would be useful to have a set of kind of indicators that could be used across different countries as to what would be, kind of implemented, partially implemented and not implemented on the range of different parameters that you're looking for within the dementia plans. Because in terms of how you do this, I suppose each of these countries will have a local Alzheimer's society. Mm-hmm. So, but I think it would be nice to be able to look at that, and you could look at the implementation in relation to when the plan started, halfway through, and at the conclusion of it. Because I know some plans have been started and already expired, and other ones are, about to get going or being refreshed or revamped or things. Yeah. I don't know if there's. Thank you.
I just want to say that the plan seems to be a piece of the part of the plan is it's evolving, and it changes, and so one of the important points of a plan should be strengthening the workforce capabilities of the people caring for their loved one, and that is something that we're looking at in driving the Ministry of Health to include some kind of incentive, like an incentive for training that family caregiver, and also educating them and providing training. But I think that's something that, it's always evolving and changing. But as we implement, it leads to something else that I see as a gap, right, that needs to be addressed. I hope that answers the question.
Did you have a question? You have a quick question, and then we'll listen to Sirpa. She's waiting.
Okay, excuse me, maybe my English is not very well, but are you planning that due to military situation in the world, due to strong migration process, the population in different Europe country may be changed due to migration process? What plan about it? And a few years later, the population of old people will be large due to migration process.
Are you speaking about the humanitarian crisis in Armenia? Okay.
The whole world.
The whole world, there is, okay.
I mean, so migration.
I see.
Migration, increasing the numbers of older people living in different countries with a diaspora population. Is this the question?
It's conference about Armenia or Europe?
Do you want to ask it? Sorry. To all. There we go. So, is there anything in any of your plans that's focusing on some of the diaspora population that is as migration is an issue we know in the UK, but in different countries, is that an aspect that you've been dealing with in any of your, or an area that we should look into?
Well, it's not an issue as itself that we have been addressing yet, but as an association, we are aware that some people are living in France and don't speak French, for example, so we need to adjust our documentations and the information we can provide in different languages, and we try to work on that really carefully, and this is also an issue I think we will need to raise, building this strategy and anticipating about the issues of tomorrow as well. Mm.
One more quick one, and then we'll listen to Sirpa.
David Mesa, I am on the group here. Just if it's helpful, my understanding, following the meeting which took place in The Hague 2 weeks ago, is you remember that the dementia strategies come from a World Health Assembly resolution of 2015, that actually a decision is now highly likely that there will be a mandate put to the World Health Assembly in May of next year, that actually there should be a new mandate that all member states should have dementia plans by 2030, and those that already have them should update them by that date. Now, you could argue that's a step forward. You could say, well, perhaps it's a little bit of a step backwards. But actually, it's a new mandate, which they'll then follow through on. So it partly addresses updating those who've already got plans, but also a commitment for all members of the World Health Assembly, which I think I'm right in saying now is 203 at the last count. So hopefully that might be helpful.
Hot off the press. It'll be very interesting when you look at how you know, the map that we had, how long it took to get those few. So I'm really, you know, it's great news actually that there's an extension, and that there's a potential for one. Actually, it's absolutely what we need. But watch this space. Thank you so much. Now listen, Sirpa's going to speak, and then we might have time for one last comment from each of you. But let's let the MEP speak.
Hello to everybody. We all who have passed our middle ages know how it does feel to be a young, how does it feel to be a child. And you remember when you were a child and a youngster, you sort of thought that the elderly people never had fun. They never fall in love for the first time, and they couldn't possibly understand what's going on in my life. It's the bit of the same tragedy what we are having with memory disabled people and elderly people in general. We have to live our lives up front, but we do understand it only looking backwards. So we really can't understand how does it feel when you are 85 or 70, and when you can't remember certain things, and that is a reality to you. And then that actually means that you can't be sort of trying to have a reality therapies, because you do not shout to a blind person, try to look, because you know that the person are not able to see it. It is the same thing. If something doesn't fix on your memory, it does not exist. So it is not about the trick how you re-memorize it. Well, what that leads to is that we would need to change our ways of making national and other dementia, Alzheimer's, memory disabling diseases, care policies, research, and plans. We need to look from the perspective of the person. And that means we have to interview, we have to live with, we have to listen a total diversity with elderly people, especially elderly people with memory disabling diseases. How they experience world, what are the best that kind of a visual hints that can be around, how to develop the digitalization so that it is not limiting and restricting, but it is enabling tool that can be tailor-made on my needs. How can I use artificial intelligence better to remember and understanding what is happening to me? How can I reconnect with the people? How my life as an independent person can be best supported? Please do not build me the reports by 20-year-old men when I'm 85 and a female. Please do not bring me smiling robots and huggable perky cats and dogs that are artificial. Bring me a real cat and a device that can feed me and wash me when I need. So the needs, what we need from the digitalization, robotics, and the technology are very diverse and different, and we would need to have the say for that. How I want to live? Do I want to have multiple or one or the same sex, or what kind of a sexual partners and sexual life? Or do I want to have a solitary life? Do I enjoy staying late in the nights and having party and funs? Or do I like to pray, meditate, and very simple, quiet life? The way we are supported should support our personalities, our choices, and our independence, not to try to fit us in one mold like small children. Okay, this is how they need to sleep and eat, and this is how they should be washed. So do not shrink and restrict the personalities, but support them to widen. This means participatory walks in our different environments and urban environments. It means memory-friendly cities, transportation, housing, and digitalization. And it means a way when me, you, and all of us can tolerate and support those of us who can't remember anymore, and yet it might be the case I'd be sitting in the same situation at some point of my life. And the life itself, love, the warm breeze, butterflies, cats purring, and the first taste of ice cream in the summer, they are as good whether you memorize any of the algorithms or theories or works or poems of great thinkers in the history. So the value of the life and the life itself can be as good as with total perfect memory. I hope that this helps you to navigate yourself for better national plans or for people with memory disabling diseases. Out of institutions to community-based living and on independent own house living. That is the goal, with personalized budgets. All the best for your workshop, and please keep me informed what kind of results do you get out of there.
There we go. I can see that we're almost out of time, but I think this is a great way to finish, talking about the value of life. And I love how Sirpa put it, birds singing, cats purring, the first taste of chocolate ice cream in the summer. What can be better? If I can just ask colleagues, just before I thank you, just to say one word of wisdom that you would well, maybe a couple words of wisdom, but not too many, because people are going to jump on a bus and go to the networking dinner now. So what's your best bit of advice for anybody who might be starting a national plan? Quick fire. Jean, sorry. You first, Lorène.
Okay. Starting a plan and building a plan is a road, and it has difficulties sometimes, but we must never give up, and we must keep on listening to people directly concerned by this public health issue, and we shall never give up, because it's a hard word, but we are all together, and we can find support from Alzheimer's Disease International, Alzheimer Europe, and between us as members. Thank you.
I would say the biggest piece of advice I have is to make sure you have a very diverse, multifactorial stakeholder group that includes religious leaders, pension plan specialists. So thinking out of the box, that's represented on your group, stakeholder group.
Yeah, I think you just took the words from my mouth. I think building a collaborative stakeholder group, a coalition of stakeholders who are not restricted by election cycles, by ministerial appointments moving, and so I think we building that coalition and embedding within that lived experience those people who are living with dementia and their families and carers. Just as Sirpa said there, I think everything that we do should be judged by, so what difference is that making to individual lives? And I think it's that gap between the aspiration of policy and people's lived experience, isn't it? And we can never make progress if we forget to listen to and involve people with dementia in every aspect of those plans and the delivery of them and the governance of them.
Thank you, all three of you. It's been fantastic. Please join me in thanking the panelists. It's been wonderful. Thank you.